Acute lymphoblastic leukemia all in children. Acute lymphoblastic leukemia all is a type of blood cancer that affects immature white blood cells called lymphocytes. It is the most common malignancy diagnosed in children under 15, accounting for approximately 23% of all cancers and 76% of leukemias in this age group. Temporal and geographic distribution. Dramatic increase. All incidence in children has dramatically increased in the UK and USA since the 1930s. In the USA, the first peak occurred in children of European origin, followed by African American children in the 1960s. Temporal and geographic distribution. International differences. The age-specific peak in incidence is hardly observed in many developing or underdeveloped countries, suggesting a possible link to industrialization. Temporal and geographic distribution. Geographic distribution. All incidence varies considerably across geographic regions. Rates are high in residents of Northern Europe, Western Europe, North America, and Oceania, and lower in Asia and Africa. 2.1 Genetic syndromes. Down syndrome. Children with Down syndrome have a 1,020 times higher risk of developing all than typically developing children. Bloom syndrome. Children with Bloom syndrome have a significantly increased risk of all. 2.1 Genetic syndromes. Ataxia telangiectasia. Children with this syndrome have a higher risk of all than typical children. Nijmegen breakage syndrome. Children with this syndrome also have a higher risk of all than typical children. 2.2 Environmental factors. Radiation exposure. Exposure to ionizing radiation, such as from X-rays or cancer treatment, can increase the risk of all. Chemical exposure. Exposure to certain chemicals, such as pesticides, can also increase the risk of all. 2.2 Environmental factors. Viruses. Some viruses, such as Epstein-Barr virus, may contribute to the development of all. Diets lacking in fruits and vegetables may increase the risk of all. 2.3 Other factors. Gender. Males are more likely to develop all than females. Age. All is most common in children under 5 years old. Genetics. A family history of all can increase the risk of developing the disease. Important notes. The above information provides a general overview of all and its risk factors. Individual risk for all varies, and not everyone with risk factors will develop the disease. If you have any health concerns, please consult with a medical professional for advice and examination. Additional information. All is treated using chemotherapy, radiation therapy, and bone marrow transplantation. Survival rates for all patients have significantly improved in recent years, thanks to advancements in treatment. Conclusion. All is a serious blood cancer, but the chances of recovery have greatly improved thanks to advancements in medical science. Understanding all risk factors can help us prevent and detect the disease early, thereby increasing the chances of successful treatment. Further reading. National Cancer Institute. https www.cancer.gov. Types. Leukemia. Child. Acute lymphoblastic leukemia. Leukemia. Lymphoma Society. https www.lls.org. Leukemia. Acute lymphoblastic leukemia. I hope this information is helpful.